Annette Aguon from the Department of Public Health. Let me just get you her title. She is Bureau of Communicable Disease Control Administrator. And that basically means you're in charge of the contact tracing. Is that right, Annette? Good morning.
Good morning. Good morning. Yes, that is correct.
Okay, and it's Chris and Sabrina here, Containing COVID. Thanks for joining us. Your first time on the show?
Yes, sir.
Okay, so here we are. How's it feel?
A little nerve-wracking, but thank you for having me.
Do you know anything about Tom Atta?
Yes, we worked with him at the start for the airport shooting.
Okay. Yeah, because he resigned. We're just checking everybody if they heard anything.
No, sorry, no.
Okay, but what you have heard about, though, and what you're working on is the contact tracing investigation into these airmen who we now know disobeyed direct orders that mandated they only go from Andersen Air Force Base to the Guam Reef Hotel. And you know what's frustrating a lot of people here, Annette, is the public feels like they deserve to know where these airmen were gallivanting around to. And that's something you guys are in the process of investigating, right? So let's just go back to the beginning. When did you guys find out that these airmen disobeyed direct orders? And how did that determine the way you guys move forward as a unit?
We found out last week, sir, the military still has to report to the Department of Public Health any communicable diseases that they identify or they test for. And so these individuals that were tested were initially reported. The first one was reported June 13. And then over the course of the next few days, that's where we saw, as it was released in the JIC, another positive, two more positive, and then all of a sudden we had 4, then 7. And so we are already in communication with Andersen Air Force Base as well as U.S. Naval Hospital, who is conducting the testing for the Andersen Air Force Medical Wing. And so in that communication, we receive information based on where they were quarantined at, and interviews were conducted by Andersen Air Force Base and provided to us that they did not follow their restriction of movement orders. And so that's where we started to get information of where were the possible establishments these individuals went to while violating those orders. And so we initiate our contact. We are still waiting for more information in regards to the dates, length of time, were you inside, outside, were you complying with the face covering or wearing of a mask, social distancing. And so those are the things that my team has to sift through and gather and cross-check information to verify, okay, we talk to the establishments as well to get their policy and procedures for their safety measures. And then from there, we notify, possible exposure, to see if anybody is sick. Are there any other means of exposure, meaning has anyone traveled recently or been in contact with someone who's traveled? We coordinate in regards to testing, and so that's what my team has been doing over the past few days, sir, as we get the information.
Right, and that's kind of disturbing that you guys knew since last week and we only found out. Did you mean late last week, early last week, middle last week?
You said the 13th?
Well, the 13th was the first case, and so then the military does conduct their own contact tracing and case investigation. And then as other cases started to come up and they see the pattern and they notice, okay, it's from that unit that was deployed to Guam, and it's from, they're being housed at their quarantine facility. Again, this is not the Guam facility. This is the military Andersen Air Force Base quarantine facility that they utilize. And so we get that information, and then based on that information provided to us, then that's when we say, okay, they're reporting they didn't follow their restriction of movement orders. Then as information is being provided to them, Andersen reports it to us that, okay, yes, they did go outside to establishment. So our contact tracers have been working on that, sir.
So let me get this straight. You guys do not have direct access to these airmen? You don't have a way to ask them? You're just getting everything secondhand from the Andersen brass?
The Andersen Public Health section provides us the information, they are required to report to public health like any other reportable communicable disease. And so that's how our process is. They provide us the information out, and if it involves any civilians that reside off base, outside the gate, public health now will step in and assist them. If it involves a possible exposure at establishments outside the gate, then that's where public health is the main agency that will then deal with notifying the local establishment and the owners or the managers, as well as the staff. And so now we work with those establishments to provide us the list. And again, we have to go through the information of dates and times. These individuals were reported to be at their establishment. So again, we have individuals where they'll give us the whole list, but then we have to sift through it and say, okay, not all the employees were on duty at that time. They were the morning shift versus the afternoon shift or evening shift. And so that's where my team now has to sort through it and identify who are the close contacts.
And Annette, let me ask you, in the event of a regular contact tracing investigation, you would be able to question the individuals themselves, right?
No, normally we rely on our military partners.
No. I'm talking about on a civilian side, like outside defense. Okay. So let me ask you, are you confident that you guys are being able to conduct the best trace investigation that you can when you can't even directly talk to these airmen who disobeyed orders?
Yes, sir. Based on the information we are getting, and again, we go back and forth even with the military, public health, as well as through our chain of command to their chain of command to provide us all necessary information so we can conduct the best case investigation and contact tracing. Again, we voiced that it's urgent and that we need as complete as possible. And the military, again, they have to comply with sharing the necessary epidemiological and medical information without violating any HIPAA, confidentiality, but what we need in order to do our job for outside the gate.
Annette, let me ask you, because we had heard that these airmen had dined as far away from Tumon as Talafofo. Are you able to confirm any of that, Annette?
I'm not allowed to confirm or deny anything, sir, but whatever information is shared with our team, we will investigate it fully. And again, we work with the managers or owners or supervisors so that we can reassure them that we are conducting our investigation. We provide necessary information, and if there's testing that needs to be done, we will coordinate with them as well as for their employees so that they're taken care of on our side.
I'm sure, though, you can appreciate that the public feels like they deserve to know whether or not they're being exposed at these businesses that these airmen went to when they defied the orders of the superiors. So when I hear that they were, eating down in Talafofo at a restaurant, hee hee ha ha, endangering our people, I think our people deserve to know. So when are they going to know? After you guys go and test everybody at these establishments? Or if you could just walk us through that part of the investigation, because we're hearing that they dined in Tumon, which is obvious, and then as far down as Talafofo. And that, if you're on restricted movement to go from Andersen to the Guam Reef Hotel, I don't see where Talafofo or even restaurants in Tumon fit into that equation, because Talafofo, that's way off the reservation.
Yes, sir. Understood. Yes, we work diligently to identify the close contacts, and so those are the employees. And that's why we also have to talk to the individual establishment. What are your social distancing policies? What are your safety measures that you implemented for your staff as well as your other patrons? And so based on that information, we always start with the closest contact, which of course are the employees who had interaction. Then there's also that information of, did they dine in or were they just takeout? And so was it indoors where they had to come in and pick up the food, or was it just outdoors? And how long were they at these establishments? Because if it was less than 10, 15 minutes, then that really reduces the exposure to other individuals, even the employees and other patrons. So we definitely want to concentrate on those who had more than 15 to 30 minutes direct contact with these individuals, even if both parties were wearing the mask and practicing social distancing, again, because this is a novel virus and we want to take all necessary precautions. So we work on from the center out, as we would say, because and then as we need to widen our contact tracing, we will do that, sir, based on the information we continue to gather as we increase testing to those individuals that we know had closer and longer exposure, and then from there we will then work our way out, because we also don't want to cause undue panic for the public. We want to assure them that we are working with Andersen. Right. Public health is doing their part, and again, there is that issue of testing too soon, and so that's why too we have to interview every individual employee and check on signs and symptoms. We have to verify were there other possible exposures. We've had already, we're more than 2.5 months into this, and so again with this small island, we're double checking our databases, because what if these individuals were on our list from a previous case, and as you all know, we had very limited test kits back when this all started, and so we couldn't test all of the contacts. So again, those are the things that we have to make sure we don't duplicate our case reports, our contact reports, and to see have we tested them before or not, and then provide them the testing, since now we do have more available. And again, yes, sir.
So you guys tested employees at the Guam Reef Hotel. Are you able to tell us, have you tested any employees at any of the dining establishments that these airmen went to when they defied the direct orders from their superiors?
No, not yet, sir. Those are being coordinated, as well as, again, there are some establishments who are asking, can we have definitive dates? And that's where, again, we're getting that information from the military, and as soon as we get more definitive answers, we contact those establishments, because then that will help them narrow down their list of employees who were on duty at that date and time.
But you talk about undue panic. I think what's causing an undue panic is the lack of information. When people are out here guessing where these guys went, and fearing that they may have been exposed, or wondering why they were allowed to gallivant around the island. Let's address that, Annette. So this is obviously a huge loophole for Department of Public Health and Social Services, when we have these military components outside the baseline, doing God knows whatever, with no supervision, either from the military side or from public health. So that being said, in the future, when we have these troop movements staying in these hotels, is it going to be public health that polices where the hell these guys are going, or where they're not going, or is it going to be, are we just going to rely on the military again?
No, so we've mentioned areas of improvement. We've recommended that up our chain of command to not only Andersen Air Force Base chain of command, but also to Joint Region Marianas. And again, this is a collaborative partnership, and so we've provided them the recommendation of what areas needed to be improved. And again, it is the responsibility of DOD, the respective branches, in regard to their respective quarantine facilities, especially if they're utilizing one of our hotels outside the gate. Inside the gate, yes, that's their purview, but yes, that is something that we work directly with them and have provided the necessary information. I have a colleague who's overseeing the containment and infection control branch, and he has been working diligently with them to point out these are the areas that need to be improved, and to cut off that loophole, as you mentioned, and so that we don't have this repeat down the road.
How many dine-in restaurants and local businesses does the team know of thus far, and have contacted about possible close contact or any sort of contact with these Air Force servicemen?
We've received information of approximately 14, and again, some of them were they picked up the food and left. Then there's others where we were reported they reported a location. We need a date, because again, by going in and saying, okay, you were possibly exposed, there are the owners and managers who want to know what date and time. And again, that goes back to also our general public. If we just say, this restaurant or this establishment was where one or some of these airmen went to while violating the restriction of movement orders, people are going to start, oh my God, I was there on this day, but not realizing it's outside of the possible infectious period. So that's why too we need to make sure we have all the information complete as possible, so that we can go back to the establishment on these dates. And would you happen to know other patrons who attended or were there at this time and date? Yeah. Because if we just say a date, we don't say a date, we just say a location, people are all, I've been there. and it could have been 2 weeks ago, which is beyond what we're focusing on at this point in time.
Right, but when did the military move all of the deployed service members up to Andersen Air Force Base? Was it after the first airman tested positive on the 12th?
Yes, because again, they look at, again, within their quarantine facility, was it just this one individual? What were their movements within the unit? And then, because it was only one at the time, so as soon as someone became positive, they automatically moved them and isolated them onto Andersen Air Force Base. So as they were seeing slowly increasing numbers, they would move those individuals and continue to do their contact tracing, spreading out. And again, these individuals are located on different floors of the hotel. And so, we would do the same thing at Public Health. We would work from the center out and continue to do our case investigation and contact tracing to see where was any interaction besides the work site, and then move them in. So as the cases increased last week, Andersen moved them as quickly as possible onto their base, and there was no more airmen from this deployed unit outside.
But this was after they already went to at least 14 different establishments outside of their restricted movement orders.
Yes.
And
unfortunately, yes.
Would you guys say that so it would be between May 25th and June 12th where they may have gone out and about and gallivanting or getting food?
Those are the initial dates, yes, because as we started to get reports of cases, our military partners were looking into it as well, and then
when were all of them officially moved? All of them out of the Reef, and it is only the Reef Hotel, right? That they were staying
for this specific unit. Yes, ma'am, the Reef Hotel.
So, are we checking other hotels where other units might be staying, just in case? Are there other units staying at other hotels?
I have not received reports of any other locations besides Reef Hotel.
Okay.
Mm-hmm. So I guess there are other units that are here, right? On Guam? Aside from the one where we're seeing this cluster?
To my knowledge, I've not been informed of any other units.
Mm-hmm.
But if they are, the military is taking the necessary precaution so that there isn't a repeat of what happened.
Like they did in the first place. Are you able to tell us where did this unit get deployed from? Because they won't even tell us that. And I'm sure you, as the contact trace investigator, that's got to be. I don't think you're bound. You're not in the military, right?
No, sir. But again, we do respect what the military is allowed to release out. I do know that they're.
What do you really think? You really think it's operational security, or you just think they don't want to tell us? Because it just seems like they don't want to tell us.
I defer.
So you know where they were deployed from.
I know of some areas, but I'm not authorized to release that information.
Okay. So are they from different areas, or just one location?
And again, this is. The deployment of various units here to Guam is something that occurs regularly on a rotational basis, and I do know that individuals are deployed for different lengths of time.
Right. Yeah.
And so that's about as much as I'm authorized to release. I'm sorry.
When you talk about, you keep saying this is a cooperative, it's a collaborative, but yet you're not allowed to speak to or communicate with the airmen who disobeyed these direct orders from their supervisors. What about the turnaround? Because I feel like we're racing against the clock here where, we, the people of Guam outside of the military baseline, are now having to wonder which 14 establishments these airmen went to. And I'm curious about the turnaround. So when you say it's collaborative, do you have like a direct line, or do you have to send them your questions in writing and then, like the media, wait a whole day to get an answer? How collaborative is it? How cooperative is it? And are we further jeopardizing the people of Guam while we sit around and wait for the military to decipher everything that, so they can put it out in a way where it doesn't compromise this or it doesn't compromise that or the operational whatever?
As soon as we receive the information, and the questions are basically the same in regards to case investigation and contact tracing for coronavirus. As soon as the military receives that information from the individual, they do provide it to us. Yes, it would be great that we had the direct face-to-face interview. But again, we trust and we rely on our military partners to get that information and provide it to us just as quickly as possible, because yes, it is very time sensitive. And as soon as our team gets any information, we act on it and we initiate our part in regards to contact tracing.
Right.
So yes, there is the lag time that I would love to avoid. But even if they were not military unit, we see the same problem outside the gate, unfortunately, be it with public or private partners. And again, there's a lot of factors into it. How long did they wait to go get their test results? When did they get the test and the timing of it being released and coming back, the communication. So again, this is not a challenge specific to the military-public partnership. It is something that we unfortunately do experience
ma'am, but
outside the gate.
But I mean, again, there's a clear difference between investigating a civilian cluster and having to, kowtow to the military and wait for them to give you info. Because you're saying that you encounter the same thing, but let's be real, you're dealing with way more secrecy, a lot more barriers with this investigation than you would with like the Hoffaday Bingo one, right?
Yes, you do point that out correctly, and so that's why we've been fortunate that we were able to go bring up our chain of command straight to the governor and saying, as the governor, can you please go to the top brass for the Andersen as well as Joint Region Marianas, so that they can assure us they are cooperating fully. And so again, being down here at the lower level in this agency, we as we hit a barrier, we definitely brought up a chain of command who then, our request was, can we just go to the governor, who can then at her top level talk to the top military brass, and so that it doesn't further impede what public health has to do on our part for our residents outside the gate.
Okay, that's great. I wanted to ask about, you said the 14 venues. What about transportation companies, taxi cab drivers, bus drivers?
Stroll.
How many of them have you guys contacted?
Those are being looked into again because yes, there's the various means of transportation, and so we are concentrating on the establishment that they went to, information in regards to their transportation method. As it comes in, then we will act on it as needed. If there was just amongst their own individual rentals, then those individuals have already been taken care of.
During the press conference, the Air Force announced that they had tested, I believe, all of the service members over the weekend. Did Public Health get the results?
Yes, and actually it's the reports coming out from U.S. Naval Hospital. They are also assisting Andersen Air Force Base. So those are the information that's being pushed out on the JIC with all the different reporting sources.
Okay, and so do we have all the results from all of the service members that were deployed?
For that deployed unit, yes, ma'am.
Okay, and so the 22 were the ones that tested positive over the weekend, right? And then for a total of 35, 37?
35 from the deployed unit, and then there were 2 individuals who are military that were also tested, but they are not specific to that unit. They were a different unit here on Guam.
And then how many tested negative?
Of the ones that were tested, sorry, I'm trying to do my math here.
Right.
There was 92.
And that's 92 of the unit that's deployed here, right?
Yes, ma'am.
So that's 92 plus 35. That would be, we're looking at 127 members of this deployed unit.
Yes.
Total gallivanting.
14 different venues.
Or not all of them,
Right.
but we're looking at 127 people in this unit that were deployed to Andersen Air Force Base, but we just don't know where.
Yes.
Where from?
Where they were deployed from, correct. And not all of these individuals violated the restrictions.
Right,
But but then again, that's according to the military because you can't ask them.
Yes,
right?
sir.
Okay. So, and I'm just concerned, like, they don't have any motive to be honest with us. They weren't honest with us in the first place. They're fine inside the fence. That's why I'm trying to make sure that we're getting what we need to get from them for the sake of everyone who lives here permanently.
Correct. Yes, sir. And again, it's a delicate balance for them because we do host them. I mean, Guam put out its best foot and our best hospitality for the Teddy Roosevelt, even though I know there were a lot of complaints and all that. But again, it was the humanitarian thing to do, and I know with the U.S. Naval, they were very appreciative of that, as we saw in the footage that shared as they were leaving Guam. And so that's something then that the military, yes, inside versus outside the gate, but we are a critical partner for them.
Critical, but they won't let you talk to the people you need to talk to.
We will go off of. We're reassured that their team is handling the investigation.
Just like we were reassured that these airmen were on restricted movement orders and that they were going to follow their orders because it's the military, and anybody in the military knows that when you get an order, you follow it.
Correct. Yes, sir. And that is where the loophole is being addressed, or was already being addressed, because that was definitely highlighted of they're not complying with their orders.
Okay. So, Annette, just so we're clear, 127 were tested. That is 127 from this unit that is deployed here to Guam.
That was deployed, yes.
Is there anybody else that needed to be tested from this unit? That is it, 127.
For that unit specifically, they were the only ones. Then the two that were tested who are not in the same unit. And so now it's for us, public health, to do outside the gate for our local residents.
You said that unit. So is there another unit that's being tested?
No, ma'am. No other unit being tested. But again, I'm not privy to all the different units that have a rotational schedule out
neither
here.
Are we.
Again, it's something that normally regularly happens for rotation of units being deployed to Guam and other parts of the Pacific region. So I'm aware of this unit that has the issue of positive cases, and that's who we're focusing on right now.
Okay.
So when are we going to know what establishments and venues these guys went to? Because it's causing undue panic. It is causing undue panic already.
Yes, understood. And when we get the definitive dates for these various establishments, that's where we concentrate again first on the employees, and then that information is shared with my upper management to the Joint Information Center and the governor's office.
Yeah, but
in regards to information to be released.
Is it true, Annette, that every day that we don't get this information is another day that somebody local could have went into this establishment, been exposed, maybe, God forbid, contracted COVID, and then gone on and infected Lord knows how many other people? Isn't that accurate?
That is accurate. However, I also would like to point out this may not be the only place that an individual could be exposed, and so that's why we have to continue to reemphasize. Locally, our cases have gone down. However, we are seeing again with the opening of the airlines, as we relax the restriction of movements locally, that people are increasing on gathering and going out and about. So again, we have to emphasize practice social distancing, wear your mask, don't touch your face, stay home if you're sick. Distance yourself from someone sick because you don't know if that individual also may have it and may be unknowingly exposing it to you. So again, as much as possible, take all necessary precaution because with this virus, and especially because person to person through coughing, sneezing, and direct contact, you could be exposed. And again, our biggest concern has been a lot of these cases too are asymptomatic. So again, as much as possible, if you don't need to go out, don't go out. So again, that's why we also have to backtrack and see, okay, are the people who work at these establishments, are they already in our database for being known contacts of someone else? Because what if they were never tested, they were never symptomatic, and not realizing they actually had COVID before? So those are the things that my team has to sift through. And again, we can't just blame only these military cases. There's still COVID going around the world. We're having more travelers coming back or residents returning to Guam who've been in places that are hot spots or been in the mainland where there are still cases or resurgence of cases. So again, for us to say, oh, just these military cases, no, that's not totally correct because we just don't know someone else may have had it and not tested and they're asymptomatic. So again, we just want to continue to urge people to be cautious, take the, social distancing, wear your mask, wash your hands frequently, cover your cough. And as much as possible, it's a community effort. We definitely need the support and help of our residents.
We're wearing our masks in here, Annette.
Annette, I wanted to go back to these 127 service members and this particular unit. Are you aware of whether any other service members, units, anybody else that was deployed and was staying at the Reef Hotel?
I'm only aware of this unit, ma'am, that was at Reef Hotel.
Okay.
And regards to any other military, to date, besides those two that were reported recently with the others from the unit, those are the only other military that have been reported with COVID from a different unit. And so
but they were they healthcare? Were they healthcare workers?
Yes, but they are not from this unit.
Right.
Right. But were they staying at the Reef?
No, they're different unit. They've been here longer than that unit that was deployed here.
Do you know where they were staying? Were they staying off base?
That one, they are being handled by the military, and so we are not being asked to assist. So that would be on base.
So they never went off base.
No, I didn't say that, but that the military is handling them. Our focus is the 35 who were positive that we know were outside the base and who violated restriction of movement.
So with these healthcare workers, even if they might have gone outside the base, you guys aren't conducting any contact tracing investigation on those guys?
No, if the information is provided that they were outside the gate during their infectious period, then that's where we would be informed and we would act accordingly. And so again, it's the timing of when were they outside the gate, if they were outside the gate, and if it was during the infectious period, then yes, public health would be notified and we would initiate our contact tracing.
I'm sorry, when did public health first know of the first positive from this unit? What was the date?
June 13 was when the first positive was reported out to us. Okay. On the Joint Information the military, Andersen through Naval Hospital.
So 10 days later, Annette, we're still waiting to find out where these guys, what 14 venues these guys went to.
We have information and we've already been acting on it as we get that information.
Mm-hmm.
We're not getting mad at you. I feel for you. It's got to be frustrating because you got a job to do, but you can't do it because you got to tippy toe around the military.
Right, and so that's why now we've gone through our chain of command.
Through the what is the protocol when the military military units are deployed here? Are they tested upon arrival?
That's a DoD protocol, whether they be tested even prior to coming over to Guam, and so that's their procedure that we don't control. That's the
right, but as far as you are aware, they are DoD's protocol mandates that they are tested,
and they should be tested, and that again the timing of the testing, their arrival, they are already also mandated to do their quarantine for the 14 days. And so again, timing of testing, be it military or local resident, is also critical because we've seen, again, people were testing negative, and then all of a sudden they tested positive. So again, timing of testing from the time you were exposed is essential. And because this is a new virus, there are things that we've had to shift along the way, change and update it as we get more information. But again, timing is critical. You test too soon, you're going to still show negative. You test too far away from the time you were exposed or the time you finished your symptoms or resolved your symptoms, you might show up negative. Then we have individuals who they're testing positive for a longer period of time. Mm-hmm. And so, those are all the factors that we have to deal with and sort out. But again, as soon as we get the information, be it local or military, our team does act on it and initiate contact tracing and case investigation.
Mm-hmm. Has the military public health side contact tracing teams informed public health, or do you even know how many contact tracing investigations they're conducting? Because you mentioned this one, right? And then there's the other one involving the two healthcare workers. Are there any more?
No, ma'am. They are handling the active duty members and in the base. For those that the exposure is outside the gate, they do notify us, and that's where our team is handling for any individual that is possibly outside the gate, be it an establishment or work contact or close contact. Then public health works with the military in regards to that.
Okay, so,
So
but
far,
just
no one else.
okay. So as far as you're aware, they're only conducting 2 contact tracing investigations
Outside of that unit, yes, ma'am.
outside. Wait, so it's the one involving the reef, and then the one involving the healthcare workers, right?
Correct.
And no other ones.
No other one.
Okay.
And I know you can't tell us where this unit came from, but can you say, was it a hotspot? And do you think that they brought the virus with them?
Well, I know the definition of hotspot changes all the time. There are, and again, if from the mainland and other parts of, U.S.-based military establishment, you could say there are some who are being deployed that come from areas within the mainland, and again, you're seeing the resurgence in various states, and so that is concerning. And to note, we also have returning residents who, at the quarantine sites where we found cases, in these past few weeks. So again, not to just say only the military, but we do have civilians who are either returning Guam residents
Yeah,
or
but
they're
we don't have
residents.
civilians who with 35 positive cases. I understand. I know you're working with the military and you want to be careful not to say anything to get their feelings hurt, but I get it. I do. What about Alaska? Because we're hearing that, were they from Alaska? Were some of these guys from Alaska?
I cannot confirm or deny that, sir.
Oklahoma?
Not going to state it.
Can we come up with a code? Blink twice if it's Alaska. Blink twice if
I'm
it's
so
Alaska.
sorry. I don't mean to be
Snap.
evasive, but I'm not authorized to release any
All
of that
right.
information.
That's the problem, I think, here is, this is just another reminder that there's 2 Guams on one Guam. There's one in there and behind the fence and one out here.
Understood, yes. I completely understand and I agree.
And I mean, in this case, it's sad to say, and I don't think I'm overstating it, this is a matter of life and death. That's what makes it different.
Yeah.
Yes, and so again, which brings up a good point, I thank you for saying that, is if you're starting to feel any symptoms, please don't wait for public health to call. If you're feeling, you're noticing you're having those signs and symptoms, to please seek medical care. And if the doctor feels that we should they should test for COVID, then that's an order that they will, write out and have the test done. But again, yes, we are trying to get accurate and complete information so that we can notify the right individuals. But again, as we wait and you're noticing signs and symptoms in yourself or your family member, coworker, to please seek medical care so that, again, we can determine is it COVID or not, and take the necessary steps for investigation and contact tracing and to prevent further spread of it in our community.
Well,
Right. It just is just frustrating because
Yeah.
you saw this transparency during the whole Theodore Roosevelt effort, and with the Navy, and here we are with the Air Force, and it's just so different. I just don't understand.
Manoni seemed kind of annoyed at the Air Force. I mean, I would be. What are they, Chair Force? I mean, Roosevelt, there was a lot of transparency, yes, and people were complaining about it, but, it was handled, I feel, the best way it could be handled. You didn't hear anything about the Navy going out and, eating in Talafofo or whatever. But obviously everyone makes these jokes about the Air Force is so lax and they got the easiest.
I don't think so.
No, I mean, that's what I hear.
They got the planes up there, so.
Right. I mean, and yes, we expect and we would want every military branch, especially if they're coming to Guam, be it for a short deployment or rotational basis, that yes, and it shouldn't be this inside versus the outside the gate.
Yeah.
Unfortunately, that is the reality.
We're not making
But
it
yes,
like that.
Yeah, it should be where if DOD has the protocol, it's followed across the board,
Right.
regardless of what military branch. And yes, U.S. Teddy Roosevelt was kind of unique. They came in knowing they had sick individuals, and so they kind of were their own floating city over there, and so that's why too we didn't put them into our account. So it's slightly different versus these individuals. They were outside the gate in one of our hotels,
Right.
and so that's why now they're in our account. That we're having to assist in regards to contact tracing. But yes, I
Yeah.
agree that
Yeah.
the DOD, yes, it should be across the board. These quarantine protocol and testing protocol and following those restrictional movements, because yes, we wouldn't be here having this conversation.
Amen.
But we will definitely do our part to take care of what we have to ensure for our residents who were possibly exposed, and continue to do what we need to do to notify those who have been identified and to test them as needed.
All right.
Well, thank you, Annette.
Thanks, Annette.
Yeah.
When you're ready to release the list of the 14 venues,
I'm gonna text you all day.
make sure to spread the word.
I don't.
You're gonna be so sick of us. Give it to them already.
Do you think the military has access to your cell phone? Because I'd like to text you offline, but I don't want to. I don't want it to be picked up by the satellites or anything.
I would hope not. That would be, yes, definitely Big Brother. That would not make me comfortable at all.
Okay, well, thank you for the work you're doing, and I'm sorry that you have to deal with these obstacles, because it definitely sounds like you're taking your job serious and you're passionate and you want the people of Guam to know, but you're not the boss, so.
Yes, but thank you too for helping, keep the people informed and to emphasize about, keeping everyone safe and as well as protecting ourselves.
Yep, wash your hands, Annette.
Wear your mask.
We are that media that is responsible with saying, hey, stay home. Hey, listen to the orders. Hey, wear your mask. That's us. We're not out here like hating and not, burning our masks because we don't agree with somebody. we're taking it serious, and I think that's the bottom line, is that the military, for whatever reason, at least in the case of these airmen, feel that our rules don't apply to them, that they're somehow above them, and that's why it doesn't sit well with me.
Yeah.
Yes, and I know those individuals will be dealt with accordingly.
Ooh, I hope so. What do you think's going to happen? They're going to peel potatoes for 20 years or what? Do they still do that in the military?
I'm not too sure, but I know that
send them to Guantanamo Bay.
The individuals we've talked to, our counterparts, know that they were definitely not happy with this, and that there will be repercussions for violation of those orders, and so that helps reassure us that, yes, it's after the fact, but again, it'll help prevent future repeats. Yes, I do want to thank both
I would have liked to hear that from General Boswell. I would have liked to hear, what we're going to do with these guys? We're going to take them out behind the woodshed and make sure that they don't ever do that again.
Oh, my gosh.
What?
No comment.
That's what you guys do with Ed Byrne all the time.
That's what we do with Ed Byrne. We're being consistent. I got to go. I'm going to get chewed out. Thank you, Annette.
Thanks, Annette. Stay safe.
Wash your hands. All right.
And thank you for what you guys are doing.
All right.
All right. Thank you, too.
All right.
Okay.
Yeah, thank you, Annette, definitely for that. Hey, let's keep it going on the phones here. We got just a little bit of time. We're getting Lieutenant Governor Josh in a few minutes, and we also got to do news, but I wanted to bring Senator Clint Rigel